Government support is the foundation of better beginnings, better futures. The programs that stakeholders have developed in their communities were funded by 3 provincial ministries: the Ontario Ministries of Community and Social Services, Health, and Education and Training. Developing a proposal was the first step in the government's influence on program development at the program sites. During this phase, there was tension with some of the sites. Site representatives felt that the programs were being defined by the government, that there was a lack of personal contact with government funders, and that it took too long to learn whether or not their programs had been funded.
If I were to think about those early days, what I think of is probably retrospectively looking at sort of the context and the challenge. I think the government was embarking on something that was unprecedented. So I think what they were asking us to do had a number of questions and unknowns that no one knew about. And I think one of the big challenges was how do you implement a community-based approach when also you have fixed timelines.
It was during the demonstration phase that the government exerted the most influence or control on different aspects of the program models. This government control was evident in 3 main areas: programs for children outside the mandated age group, the pace of the program hiring and development, program staffing, and operations. Once ongoing funding was announced, the projects then had to negotiate further with the government as to what their sustainable management structure would look like. The project sites received core funding from the provincial ministries to provide high-quality programs to children within the 4 to 8 age group and their families. However, programs often needed additional funds to adequately respond to the needs of the community as identified by its residents. In an attempt to address the many needs of the communities, stakeholders at each site not only partnered with other service providers in their communities to help provide for the programming, but they also pursued funds to supplement government support. Some of the additional program benefits provided by other funding sources included snack or breakfast programs at 3 of the sites, additional programming for children outside the mandated age range at 2 of the sites, expanded program times and offerings, and new equipment at a Francophone preschool program offered at 1 of the sites, and provision of a variety of community programs at 1 of the sites.
The needs of the community are forever evolving and changing, and if you only have a certain funding path, that cannot cover all the other programs maybe that are needed by the community. So it's hard for you to sustain that. So some of the ways that we do that really is we do our own small-scale fundraising. We apply for grants. And I think this is also where the collaborative aspects of the project come in. You try to tap into other resources that can be provided by other community service agencies.
From the outset, the provincial ministries funding Better Beginnings, Better Futures recommended a program model based upon a review of the literature and research. Their role was to ensure that the programs were true to this model. The project sites and the government, therefore, were thrust into a working relationship, and not surprisingly, there were challenges that arose in this working relationship. These challenges included limited time to engage residents during program development, competing demands of balancing government and funder requirements and community needs, lack of direction and support, time and resources devoted to accountability, and funding. Some of the strategies for dealing with these challenges are discussions with government and funders about the importance of allowing sufficient time to develop and implement your programs, ensuring clarity with government and funders on program model requirements, negotiating upfront for the level of support and guidance you think your organization will require in developing and implementing your prevention initiative, and renegotiate when needs change. Ensuring that programs are aware of all accountability requirements from government and funders, and building in time and resources to plan, advocate, and strategize for long-term funding. The Better Beginnings team learned a number of lessons and developed a number of guiding principles for working with government funders. These guiding principles include: core funding is necessary for the planning and implementation of high-quality prevention programs. Community-based prevention programs take time to develop. Ensure government and other funders allow sufficient time for the planning phase. Ensure clear guidelines and requirements from government and other funders. Ensure adequate time and resources for accountability and reporting to government and other funders. Develop and maintain a good working relationship with government and other funders.
Oui, est-ce que tu sais c'est quel fruit?
C'est un ananas.
C'est des ananas, bravo.
We now know, after 20 years of research on Better Beginnings, Better Futures, that we can improve the lives of children and families and enhance whole communities with our approach. We have found that by including community residents in program development and decision-making, by partnering with education, health, and social service providers, and by providing high-quality, comprehensive, and universal programs, we can significantly reduce the number and severity of problems that children and families experience. We can do this and save money at the same time. For every dollar spent on Better Beginnings programming, the government has saved $2.50 that they would have had to spend on costly education, health, and social services. The Irish surgeon and medical researcher, Dr. Dennis Burkett, once said, "If people are constantly falling off a cliff, you could place ambulances under the cliff or build a fence on the top of the cliff." We are placing all too many ambulances under the cliff. With Better Beginnings, Better Futures, we are beginning to build that fence, one that will keep our children safe, secure, and happy, and our communities healthy and thriving. With Better Beginnings, we can indeed build better futures for our children.